Right, we begin with coronavirus pandemic, and India has reported another record-breaking increase in infections. And data just released by the Health Ministry says the country has added more than 414,000 new cases. The death toll has also risen by 3,915. The COVID-19 is spreading to rural areas as well as large cities buckle under the strain of the country's second wave. CGTN's Timothy Warwick reports.
Rickshaws being used as ambulances in Delhi. Another sign how far India's resources have been stretched.
I am providing this auto rickshaw ambulance service to help the public. If anyone wants to come and go from the hospital, if any patient who is not getting the ambulance service, or the relatives of any patient who want to go to their home.
It provides a free alternative to costly private ambulance rides. A hospital in southern India has resorted to using ambulances to treat patients due to a shortage of beds. Places to treat patients along with oxygen and medical supplies are among the top concerns for big cities. The situation is even more dire in the countryside, where healthcare is even harder to access. Like this town in central India, where patients struggling for breath are being treated outside under trees. About 2/3 of the country lives in rural areas. Residents have to travel long distances for hospitals dedicated to treat COVID-19, and those facilities are ill-equipped and short of staff. Experts say the rate of infections in these parts could be 5 to 10 times higher than what's being reported due to low testing rates and less awareness of symptoms. States and cities are reinstating measures to curb further spread and to ease the strain the second wave is causing. But no national lockdown has been announced. That's despite record numbers and a warning from the central government's top scientific advisor, another wave is on the horizon.
A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves.
He says the virus will continue to mutate and adapt to vaccines, leading to another surge. That could prove devastating to leaders around the world, pinning hopes vaccines will end the pandemic. Timothy Ulrich, CGTN.
And in India's financial center and largest city, Mumbai, crematoriums have been running at capacity, with some operating non-stop. Some workers say they have not had a break from performing last rites. Now, Sabah Sharma speaks to one of them.
A deadly second wave of COVID-19 continues to devastate India. As the number of deaths rise, ambulances have been shuttling non-stop from hospitals to the nearest crematorium. In this complex in Mumbai, a Hindu crematorium and a Muslim cemetery sit next to each other. It has been overburdened by a spike in demand. Sarfaraz Beg has been working here since the complex was established about 5 years ago.
I both dig the graves and bury the dead. I dig the grave, put the body in it, bury it, and plant samplings on the grave. I do it all.
COVID-19 infections in the world's second most populous nation have surged past 21 million. The death toll is over 230,000. A weekly report by the World Health Organization said that India accounted for nearly half the world's coronavirus cases and a quarter of the deaths.
90% of the bodies coming in for funerals nowadays come packed in body bags. About 140 COVID victims have already been buried here. 10 bodies came just when the lockdown started.
The crematorium's personnel have been overwhelmed, working under challenging conditions.
The relatives don't come near. They don't even touch the bodies. We have buried bodies in such extraordinary situations that if you were to witness it, you'd feel tense, wondering how we do our jobs. When the first COVID bodies started arriving, they were not even packed in kits. They just arrived in ambulances wrapped in cloth and were dumped here. We were given the papers and told to take over. We are fighting death here. We left our houses and our loved ones. We're here the whole day because we want to serve everyone and give as much help as we can.
The nation has been gripped by fear as the coronavirus crisis unfolded over the past year.
The municipality gave us everything from PPE kits to sanitizers. They said, do what you want to do, but manage yourself. The police have also come as many relatives were scared and chose to stay away. People are still scared, right from the young to the old. The situation has become too hard to handle.
There's a constant stream of people at this complex. Jitendra Dhanuka came to collect his brother's ashes and spoke about the grim situation.
Everywhere there are dead bodies only there. If you can go inside or anywhere else, you will see the same thing. Only dead bodies are there.
As night falls and Sarfaraz Beg heads home, the bodies pour in. And the crematorium continues operating through the night. Subhash Sharma, CGTN, Mumbai.
Now let's turn to India's neighbouring country, Nepal, which reported a new record of more than 9,000 infections on Thursday. And Nepali health experts say the reported figures do not represent the true picture. And now Kanchan Jha is joining us from Birgunj on the Nepali side of the border. Welcome to Global Watch, Kanchan. So the health experts say that the reported cases do not represent the true picture in Nepali. Now what is the true picture then?
As the second wave of COVID-19 ravages Nepal, the heartbreaking scenes of residents being deprived of basic health facilities and people dying without getting treatment shows the grim reality of Nepal's weak health care infrastructure. Hospitals across the country are filled with COVID patients requiring intensive care and ventilators. The heavy influx of patients leading to a shortage of beds, medicines and oxygen in many hotspots has put Nepal in the grip of a fast-growing COVID-19 wave, threatening to bring the healthcare system to the brink of collapse. On Thursday, Nepal reported a record high COVID-19 cases crossing 9,000, the seventh straight day with more than 5,000 cases. Public health experts even say that the health system is already overwhelmed amidst the fractured economy, and Nepal has reached the point of no return. Some studies even predict that at current mortality rates, Nepal needs to be prepared for up to 250,000 deaths across the country. Health Ministry's data show that in dense population centers, 75% of COVID tests are coming back positive, while the national average remains at 47%. Because of a massive surge in the COVID-19 cases, the government on Sunday announced the suspension of all domestic and international flights till mid-May. This is the second time Nepal has suspended international flights in response to the pandemic. In April 2020, it halted international flights for more than 5 months. Experts worry that as a repercussion of flight ban and restrictions, the supply of essential medical items, including the delivery of oxygen concentrators, will be disrupted at a time when the country's healthcare is already crumbling. Reports of corruption in vaccine procurement has meant that there are no AstraZeneca vaccines even to give second doses for those awaiting their second shots, mainly the elderly population.
Right, and you are now in the city of Birgunj along the India-Nepal border, we understand. Now, how are the locals reacting to the crisis in India?
Yeah, if you frankly look at here, it's a very worrying situation down in this city. Last week, the Nepal government closed 22 border points, and now only 13 border points between Nepal and India remain operational. The border city of Birgunj, where I am right now, is also known as the gateway for Nepal and is an important transit point for trade and commerce, and is one of the 13 border points that is operational at the moment. At present, according to official records, around 200 people are entering Nepal daily through the Birgunj border. This metropolitan was one of the major hotspots last year, and as infections spike again, Birgunj is already struggling with increased hospital admissions and resources are stretched thin. Officials say that it is impossible to control the unprecedented movement across what has always been a porous and open border. Birgunj now has both imported as well as local infected cases as community transmission has entered a phase of rapid spread. Black marketing and hoarding of oxygen cylinders and essential medical supplies is also one of the major concerns of the people in this region. However, health experts have attributed the country's second wave in part to the unchecked flow of Nepali migrant workers from India and in part to weddings and social gatherings, including large political gatherings organized by the ruling party and other opposition parties that aimed to show strength during the pandemic.
And in Nepali, tourism officials have rejected reports that foreign climbers are infected with coronavirus as they try to scale Mount Chomolungma. Can you tell us more about that?
Yeah, last month reports surfaced confirming the spread of the pandemic at the Everest base camp when climbers were evacuated by helicopter were tested positive for COVID-19. Although denied by the Nepal's Department of Tourism, mountaineers and local officials confirmed that in recent weeks at least 20 climbers were flown out of the Everest base camp and were tested positive at hospitals in the capital. I spoke to a staff at a private hospital in Kathmandu earlier this morning who confirmed of climbers testing positive after arriving from the base camp. Likewise, in recent days, 20 foreign climbers and Sherpas have tested positive in antigen tests at the base camp of Dhaulagiri, one of the busiest 8,000-meter peak besides Everest. The apparent infections at the base camp have shattered the hopes of an already ravaged mountaineering sector just recovering from earthquakes and a year of COVID-19 lockdown. Mountaineering was closed last year due to the pandemic, which had a devastating impact on the tourism sector that employs more than 1 million Nepalis. This year, Nepal has issued permits to nearly 750 climbers this season only, including a record 408 permits to foreign climbers aiming to climb Everest. This spring season alone, the government has collected over 4 million in fees for Everest, and the seasonal trekking in remote area also provides money and the resources for local Sherpas who guide the groups up and carry supplies. Critics say that amid the continuing evacuations and complaints of lack of transparency over the severity of the situation, Nepal government is trying to keep a tight lid on information. They point out that Nepal's reliance on the mountains as a source of revenue has gotten in the way of safety.
Thank you. Thank you very much. Journalist Kanchan Jha reporting from Birgunj on the Nepali side of the border with India.